Anemia in CKD. Understanding erythropoiesis-stimulating agents. Imagine your body as a busy city where red blood cells are the delivery trucks carrying oxygen to keep everything running smoothly. In chronic kidney disease, the city's main factory, the kidneys, struggles to produce enough of the hormone called erythropoietin. Without enough erythropoietin, the factory can't make enough delivery trucks, leading to anemia, which makes you feel tired, weak, and short of breath. To help, doctors often use medications called erythropoiesis-stimulating agents, or ESAs. These are synthetic versions of erythropoietin designed to tell your bone marrow to produce more red blood cells. Common types include epoetin alpha, epoetin beta, darbepoetin alpha, and methoxypolyethylene glycolepoetin beta. Each has a different structure and how long they stay active in your body. For example, darbepoetin alpha lasts longer, so it can be given less often, sometimes once a week or even once every 2 weeks. Methoxypolyethylene glycolepoetin beta can last even longer, allowing dosing every 2 for weeks. When you receive an ESA, it binds to specific receptors on immature red blood cells in your bone marrow. This stimulates these cells to grow and mature into fully functioning red blood cells. As a result, hemoglobin levels rise, and your blood can carry oxygen more efficiently. This helps reduce symptoms like fatigue and improves your overall energy and quality of life. But ESAs don't work alone. They are usually given alongside iron supplements because iron is essential for making hemoglobin. Sometimes iron is taken orally, but in many cases, intravenous iron is used to quickly boost iron stores. The goal is to increase hemoglobin to a safe level, high enough to relieving symptoms but not so high that it raises the risk of complications like high blood pressure or blood clots. Using ESAs has been a standard treatment for over 30 years, but it requires careful management. Too high a hemoglobin level can increase the risk of cardiovascular problems, including hypertension, strokes, or blood clots. That's why doctors closely monitor blood counts and adjust doses accordingly. Recently, new options like hypoxia-inducible factor prolyl hydroxylase inhibitors have been developed. These are oral medications that stimulate your body's own production of erythropoietin, even in damaged kidneys, offering an alternative approach. In the context of kidney health and kidney cancer, managing anemia is especially important. If anemia is left untreated, it can worsen kidney function and overall health. However, in patients with kidney cancer, especially those undergoing treatments that affect bone marrow or iron levels, doctors must carefully tailor anemia treatments to avoid stimulating tumor growth or causing other issues. In summary, erythropoiesis-stimulating agents are vital tools in helping people with chronic kidney disease combat anemia. They work by replacing the hormone that the kidneys no longer produce enough of, encouraging the production of red blood cells, and improving oxygen delivery. But their use needs to be personalized and carefully monitored to ensure safety and effectiveness. Always consult your healthcare provider to determine the best treatment plan for your specific situation.